Hello, my name is Michael Gargano, and thank you for joining us for an important discussion with Monisha Rios. Would you like to introduce yourself for our audience?
Hi, everyone. Hi, Michael. It's great to talk to you again. Thanks for having me on. My name's Monisha Rios. I am an MSW. I'm also a doctoral candidate at Saybrook University, focusing on the use of psychological warfare on my own people. I'm Puerto Rican, specifically Viequense. And right now I'm talking to you from the tiny island of Vieques, and you're going to enjoy the sounds of our neighbors, the roosters.
Qué bueno. And thank you for joining us. So Monisha and I met when I was a PhD student at Saybrook University, where I first heard her introduce me to the concept of military sexual trauma. And today's topic will be about military sexual trauma and how to work with survivors in a trauma-informed care environment. So if you could kick us off, could you give us a definition of what military sexual trauma is?
Sure. So anyone can look online and see what a more formal definition of it is. As a person who lived through it and lives with the daily effects of it, it's a violation by sexual harassment, all various types of assault. It doesn't only happen within the ranks of the U.S. military. It is something that is part of U.S. military culture and is inflicted on innocent civilians. It's used in torture. And then when perpetrators are not adjudicated, they're not prosecuted within the U.S. military industrial apparatus, they are essentially sent into our communities at home. So the trauma, the actions that bring the trauma about, the violations, the violence itself continues to happen within VA hospitals and neighborhoods.
Yeah, and thank you for highlighting such an important issue. I know this is a topic that you're very passionate about and something that you've lived through. Can you tell us, if you have a sense of what are some statistics about how common this is in the military world?
The last stats that I was familiar with was back when I got super involved in the MST survivor movement, and it was 26,000 reports a day in the U.S. military. But the statistics always are below what we can actually say is happening. And they don't take into account the incidents that occur essentially as an act of war on occupied peoples as well.
Yeah, and I can hear you say that this goes very much undocumented. What would be some of the symptoms that someone would notice that are characteristic of MST?
That's a great question. There's the symptoms that describe the experience of post-traumatic stress occur. Acute stress occurs, not eating, not sleeping, or sleeping a lot. The symptoms of depression can happen. It's really a wide range of experiences of symptoms: sleep disturbances, nightmares, night terrors, intrusive thoughts, all of that stuff, relationship problems, fear
Substance
of
use
being in the
disorders.
public, all sorts of things. Yeah, all types of things.
And in your experience, what makes it difficult for survivors of MST to seek help and to report this, and to get any help at all?
One of the major barriers to care that exists is hero worship. It's sort of the culture that exists around the U.S. military that really exalts it and worships it, so that when anyone says anything that might smear the reputation of the U.S. military, such as the high rates of harassment and sexual violence that exist, oftentimes it's hard for people to accept that reality. And in my own experience, as well as the experience of a number of other survivors, it's often challenging for therapists to address that within themselves and to shut that part of themselves down and really be present with the survivor and not value judge what they're saying. There's also the weaponization of diagnosis that occurs on active duty as part of the retaliation for reporting, which creates obvious distrust. So if a therapist is inside the VA healthcare system or so closely related to any type of military or DoD type of system, it can be a lot harder for people to access and feel safe when they're accessing care. Quaker
So if
House
I'm
Military Counseling Center is a great resource for that.
Yeah, and so if I'm hearing you correctly too, I'm hearing you said there's this implicit bias inherent in the system where people might even don't believe that this exists, or their own internal preoccupation with what it means to be American, what it means to have a military, clouding that judgment.
Absolutely. Yep. Victim
And
blaming and shaming, the standard things that go on in society occur.
and so when did you begin to notice that something was wrong and feel like you had to do something about it?
Do you mean as far as what I was experiencing myself
Yeah.
after the fact?
Yeah,
Or
after the fact,
in the
or
moment
even during
when?
the military service, when did you begin to notice that MST was something that you experienced?
Well, I noticed while I was still on active duty that I was experiencing depression and acute stress. Of course, being in the situation while it's happening is, it's happening. But then it took a few years before I actually found out that MST was a thing. I was in a graduate class on working with military families as a social worker, and that's where I learned that this is what happens and this is what it's called, and it's actually something that you can report and get care for. But then it was a long time after that I was actually able to access care. I started seeking it right away, but it wasn't exactly available right away.
And if I remember from our previous conversations in the past, some of that has to do with the VA and their ambivalence about addressing military sexual trauma within the VA and the military services. And one statistic I read said that 76% of victims go unreported. You had mentioned that fear of retaliation is an experience that often people have to not report this, and it seems like shame and worrying about what will happen to me if I report this in the military. Can you speak to that a little bit from other people that you've worked with, other survivors that you've had experiences with?
Sure. Yeah. Well, oftentimes when you do report, it's not confidential. Your unit ends up knowing, and then that's when more problems occur. If you go to mental health, oftentimes people will be given a diagnosis like a behavior disorder to essentially discredit them. There's violence that follows. I was threatened with violence if I spoke up, and they came to follow through on that threat. Vanessa Guillen recently, her murder, there's even the threat of death as retaliation. Lavina Johnson is an unsolved case from a long time ago, and that family still has not had justice because another form of retaliation is ignoring the problem and not investigating properly, and then mislabeling a crime as a suicide, for instance, as is what happened in her case.
So I read somewhere that a lot of what keeps MST survivors from reporting it is this want to maintain a sense of normalcy and move on, which we see in a lot of other traumatic situations. The shock to the system, this denial that it didn't happen to me, maybe I didn't remember it correctly. Is that something you see in your experience with other MST survivors?
Yeah, and it's why it takes a lot of people, sometimes years, decades, before they talk about what happened, before they can even verbalize it. Because we're taught to move on. We're taught that we should be strong and we should be able to take whatever comes at us as a soldier or airman or Marine or sailor and do exactly that, move forward. So that plus, the culture of shame and blame is oftentimes a running narrative in people's minds that prevents them from acknowledging what happened, even sometimes for themselves.
Yeah, and I'm also thinking of the diagnosis of PTSD and this not wanting to look weak historically in the military, going back to, the early days of World War II and World War III with shell shock. So can you speak to that a little bit about not wanting to appear weak and having to come to terms with this and what it's taken you to go from that thought, if that was something you believe, to resiliency that I see a lot in you today?
Great question. Yeah, I did have some of that internalized stigma happen for myself, where, that stigma exists in society anyway, even though as a profession, we've been working on, destigmatizing accessing mental health care. Accessing, did I say that correctly? Accessing mental health care. Yeah.
Mm-hmm.
Sorry.
You're good.
But when I first was actually diagnosed and I read it, I had to share my diagnosis with an employer. And I read it on paper. No, I had to share it. I had to share it with the university for ADA accommodations.
Mm-hmm.
And something about that moment, that first time that I read PTSD, post-traumatic stress disorder, depression, and an eating disorder, it took me down for a couple of weeks, because right away I thought, I just felt like a defect. And I carried that judgment with me for a long time. And I became, in a way, sort of obsessed with healing, because I felt like if I can hurry up and heal, then maybe I can have a normal life. Maybe I can be normal.
Yeah.
People won't think I'm crazy or weird if I go to a professional conference and I have to have a roommate and I have a night terror, which
Mm-hmm.
has happened.
Yeah, and I remember when we first met, and you were very bold, I think, about talking about military sexual trauma, and we had some conversations about boundaries and what do survivors need in order to feel safe. So if you could comment on that a little bit about what sometimes we as therapists need to help MST survivors do to feel grounded and safe in the moment.
Thank you. I think that would vary, obviously, person to person. Something that I have in common with a lot of the survivors I've met over the years is being able to control your space. And oftentimes that gets pathologized, but it's not a pathology. It's really just, you have to be able to feel safe in order to do the work of healing. And so you have to be able to do as much of what you need to do to feel safe in the healing spaces that are provided for you. So if, let's say, you're treating a woman who's been violated by men, you may definitely want to consider seeing that person at a time when there are no other male clients that would be in a waiting room, or when you have a woman or non-binary person or someone who is not triggering, let's say, working your intake or your front desk. If that's your main thing that you treat people for, you can obviously arrange your business for that, but that's not always possible. And even in VA hospitals, it's difficult to even move through the VA hospital to get to the area that you're getting treatment in, because you have to walk through full of male veterans, any number of which could be themselves perpetrators. Walk through sometimes the same trauma happening new before you get to your appointment. So creating that safety is essential. Without that, nothing else can happen.
For sure, and I'm grateful that you're able to, expand on that topic. And I think part of the criticism of the VA is its historical difficulties with access to care. And part of that, my understanding, is also the MST coordinators and how MST survivors access disability services within the VA. And if you could shed some light on that for us, I'd really appreciate that.
Yeah, that was something that the movement was fighting for a long time, and most likely still is safe access in VA hospitals. And it's not just like safety of not having to deal with the same trauma that you've already dealt with. It's the quality of care and the provision of care to women and LGBTQ veterans is not up to par in most VA hospitals. Around the time that we met, I was living in Delaware, and I was going to a VA hospital whose women's clinic was only 4 years old.
Wow.
And they didn't have the services that women needed available. And they didn't have a dedicated waiting room right away. So there was a lot that was wrong there. And we had gone so far as to reach out to Congress about this, to ask human rights investigators to come visit our hospital, go to clinics in other states, and they were set up. They were very supportive of women. They had quality care for the women, but the majority did not match that. So it's always been a struggle to have parity and equity in accessing healthcare for women veterans.
Yeah, and I think hopefully that will change soon. But I think it's going to take a lot of work on the part of not only the VA, but other systemic issues that are at play in terms of how we view women in our society and the quality of services that we offer.
I agree. And then I think too, with how as a society we're advancing beyond the gender binary, I think it's important that the growth not stop at just providing adequate services for cisgendered women veterans. It has to go all the way. Our trans veterans need safe access to care, and they need quality care that meets their uniqueness, because they're also victimized by military sexual violence. So are men, and always the issues arise when people in our field, for instance, have a large responsibility in that, and that's not really taken as seriously as it needs to be. So when survivors like myself have even gone and spoken with military psychologists, people who identify in that category and who provide services specifically for veterans or active duty personnel, there's again this wall that comes up to receiving any type of critique or feedback that calls them into question in their own complicity, and not only perpetrating the crimes, that keeping them under the rug, denying that they exist, but then in the care sector, in the civilian world too, there's a lack of critical examination of where we're messing up.
And that's why
always been an ask from our own people, is to do better.
Yeah, and I think a lot of what draws me into your work is your need to decolonize and demilitarize both psychology and transformative social change. And can you speak to where that conviction comes from, and kind of where you got interested in this line of research?
I really appreciate you asking about that. So part of my personal healing from MST involved getting involved as an activist in the movement, becoming grounded in my truth, but also becoming open. Taking the steps to heal allowed me to be open to shredding the veil that I had, the hero worship I had, and the glorification of the military that I had, so that I could listen to other survivors who were not in the military, but who were harmed by the US military. I learned about the women in Okinawa who, from World War II on, have been continually violated by US military personnel. And Okinawa has the largest number of US military bases per square mile than anywhere in the world, including the United States. And so then as I learned my own history as a Puerto Rican and learned about the militarization of our islands were not just one, and that is a result of colonization, that is a result of our dehumanization as essentially owned people, and what that meant for Vieques, where my family comes from for generations, where the U.S. Navy, the Atlantic Training Fleet, used 2/3 of our island for practice for all but real war for over 6 decades. And then, just like in Okinawa and just like in all the other places that we have military installations that are populated by US troops, people had to be afraid of their daughters getting raped, their wives getting raped. They had to bring their children in at dusk when US troops would be let off duty and go into the towns. This is real. And once I was able to see and accept this reality, and that just made me realize how big of a monster this actually is, and that I have a responsibility. We all have a responsibility to do something about that. And those of us who've been inside the US military and experienced this for ourselves and know that it's real, we ought to be able to empathize with the other victims who did not choose to enlist, but yet have to live with. That's a completely different level of trauma than we will ever experience.
And so there's multiple levels of trauma, as you're mentioning. And you wrote an essay a while back about moral injury in a book about the military and trauma. If you could speak to that for our viewers.
Thanks. Yep. That's part of the result of that. What I just described to you is that I realized all these diagnoses that I had weren't really what was going on, that I was experiencing my conscience, and that I couldn't eat because I felt sick at the reality, and sick at the continued oppression of people in the name of the United States. And so injury is, particular way by our Western institutions, but it's both the oppressed and the oppressor, and to live it as a colonized person who was in the colonizer's army. It's something that is beyond definition. And it's something that takes a lot of lives, and it's something that can be avoided. And child sex trafficking is something that I mentioned in that chapter very briefly. But that's also part of MST that does not get talked about.
Your willingness to unveil the mask, as you say, and the curtain, and really, say that the status quo that has previously dominated this culture can no longer be, this way of relating to the world. And I think that's an important piece of recovery, is that at some point the mask comes down, and hopefully there are people there that have empathy and can sit with the pain of other people, as you have, going to Okinawa and other military bases. What does it take to be able to sit with an MST survivor and not re-traumatize someone in your experience?
Be human. Don't be a professional. I mean, be professional, of course. Ethics are important, but be human. Be real. Listen. Respond from that place of empathy, and be okay with not knowing what to do, and try to definitely notice when you may be falling into that implicit bias about the military. And if you yourself are reacting to what you're hearing, if as a civilian, also take time for yourself to cope with what you're learning, because you can also experience that trauma and that moral injury of knowing this is what our country is doing. You should feel that too. And then that can help you empathize more. And so the healing work has to also be done in society. And so the power that the therapist has in not only holding space with a survivor that's healing, but holding space with themselves as they reconcile with the reality that's being shown to them, and then doing the work to change the systems that cause that reality. Because that's preventative. That can eventually make less need for a survivor to seek care. There will be less survivors.
And this willingness, like you said, to go into the depths of the uncomfortable, it's no different than racism or sexism or our biases implicit about sexuality. And I think, like you're saying, when our own stuff as therapists or as helping professionals gets in the way, that has an effect on the survivors, and helping people to thrive and live, authentic lives that promote meaning and value and worth. And a point that you made that I'd like to capitalize on is this idea of physical illness. In a lot of what I read about military sexual trauma, many survivors come to therapy or to medical appointments with somatic complaints, not being able to eat, not being able to sleep. And I'm curious if you have a sense of how many of your doctors ignored that and attributed it to something else.
Oh, yeah. Yeah, I mean, I had a lot of visits to the hospital for a year. All kinds of just was related to my trauma that I had no idea was connected. And so for years, going to physicians and having to take medication for things that weren't actually wrong. And then while at the same time going to therapy. And I got lucky to have two truly incredible and life-saving therapists through the VA who saw. They knew to look for that, and they knew to pursue that. And they also helped advocate for me when, within the VA system, when I couldn't get my doctors to pay attention to what they were seeing. So that was really helpful. And like a lot of the somatic experiences can become real illness eventually if it's not addressed in a way that's actually useful. Yeah.
Sure. Yeah. And I think, especially eating disorders is a topic that's near and dear to my heart. We live in this very body dysmorphic culture, and we often say to people, you look good, you look skinny. But that also could be the telltale sign that someone is responding from a place of trauma and wounding. So it is important to have intuitive therapists and people who are willing to, kind of dig a little deeper and say, what is the real explanation for why maybe we're losing all this weight or why we're not able to sleep anymore?
Yeah, absolutely agree with you. And also, that's something to know about military culture, is the emphasis on physique is a contributing factor a lot of times. And so that's also part of military culture, and it's toxic. It creates this toxicity in us to where we are constantly striving. So for instance, when I was in AIT, I was placed on what they called the Fat Boy program because I was 1 pound over the maximum allowable weight for my height. And so it's like hazing. It was so bad that another soldier and she ended up telling me about using laxatives to maintain weight. And so we began sharing laxatives so that we wouldn't have to deal with the social punishment as being not ideal. And that's so common.
Yeah, and this in the healing process too is the need to feel like I'm authentic, I'm whole, and I'm worthwhile. So being able to deal with mind, body, and spirit. And I'm wondering, where has spirituality come into your post-traumatic growth and your healing and your scholastic work as a scholar?
Yeah, it's been beautiful. I at our university, I was able to take hypnosis courses and actually come into my spirituality through that path because of just learning the mindfulness techniques and the breathing and connecting with the body and whatever it was inside of me, and building it out from there. And as I was doing this decolonization or beginning my decolonization and demilitarization process through healing, I learned about the practices of my ancestors and found myself committing to that and finding a lot of healing and connecting with the ancestors and prayer and knowing the struggle of my people and how our spirituality has helped us maintain and overcome and continue on stronger than we've been before.
And a big piece of what you mentioned that really resonates with me is this culturally informed and sensitive approach as a way of healing, to use culture, cultural practices, and spirituality as the vehicle to create long, permanent, lasting changes. And I'm wondering if you can recommend any resources to our viewers or listeners that can help them learn a little bit more about MST.
Yeah, absolutely. And I want to encourage people to not appropriate spiritual practices and cultural practices as a way of healing. It's really not helpful. It doesn't mean that there aren't people who will share, like lovingly and willingly share what heals them with you. But for our field, we've got a long history of doing that, and that's not okay. So like encouraging your client to seek out their own cultural ways, their own whatever their ethnicity is or whatever their cultural background is a way of doing that without also appropriating someone else's culture and causing harm that way. And as far as resources for MST, I have to actually think about that. Quaker House Military Counseling Center actually is a place that I would really recommend people reach out to learn about more resources. They're a place that is detached from the U.S. military. They're detached from the VA. They have no affiliation with them, and they heterosexual violence. And they don't charge people for that.
And we'll link to their services in the description of this video. In the last few minutes, is there anything that we haven't covered that you feel is critically important to understanding either military sexual trauma or the healing process that you would want either a therapist or someone trying to navigate these waters to know?
Our families need help too. There are a lot of children who suffer also with their their parents. As their parents suffer, the children suffer. And care for our children is not readily available through the VA. And it's not really affordable for a lot of people, even with insurance. So something to think about is how to make care more accessible for everyone, naturally more affordable, less colonial, as in not appropriating, but making sure our children have it as well.
So being able to treat the person, their family, their culture, and I think if we extend this out, also the world we live in is what I'm hearing you say.
Yeah, definitely think locally or globally as you act locally.
And I appreciate your time for this interview.
Thank you. Thanks again for having me.